I am Dr. Kaustubh Durve, Senior Consultant in Orthopaedic Surgery at Apollo Spectra Hospitals. I specialize in knee and shoulder surgery, and I have trained extensively in arthroscopy and joint replacement, including ligament surgeries in the UK. Frozen shoulder is a word which is very commonly used by family doctors, by even patients. So, what is frozen shoulder? Frozen shoulder, in short, is a painful and stiff shoulder. So, any shoulder which is paining and stiff and is not able to move, you can say approximately that this you can call as a frozen shoulder. But when you look at painful and stiff shoulders, not all of these shoulders are because of one single reason. So, there are a number of different disorders in the shoulder which can cause a painful and stiff shoulder. So that shoulder can be painful and stiff because of rotator cuff problems. It can be because of inflammation of the capsule or adhesive capsulitis. It can be because of arthritis in the shoulder and a number of other different reasons. So when I see a frozen shoulder as a shoulder specialist, the first thing which I would like to find out is why is this shoulder frozen? Why is it stiff and why is it painful? And for that, one very useful investigation, very useful test is MRI scan. So I would not hesitate to ask for an MRI scan in a patient who has a significant painful and stiff shoulder, because treatment of this shoulder is different for different causes. So unless I know what has caused it, I cannot treat it correctly. So please do get MRI scans if you're advised, because many shoulder problems can be diagnosed or can be found only if you do the MRI scan. Now coming to the treatment, of course the treatment depends on the cause. So if you treat the cause, then accordingly your shoulder will recover better. Once you find the cause with MRI scan, there are a number of different treatments which are available. So one common treatment in the shoulder is physiotherapy. Physiotherapy is a treatment of exercises. Different exercises which are done with the physiotherapy doctor, the exercise doctor, and many of these exercises can be done by the patient also on his own at home. Many patients experience that physiotherapy is giving them benefit, but it's taking a very long time to get better. And these are the kind of patients who should consult a shoulder surgeon or a shoulder specialist like me, because there is really no reason to wait for months and months for your frozen shoulder to get better. We have treatment solutions where the frozen shoulder should get completely better within 1 or 2 months. So what else can we do? Apart from physiotherapy, we have joint injections where we inject certain anti-inflammatory medicines in the shoulder which help the shoulder to become pain-free faster and to get the range of motion, the flexibility faster. And finally, there are some causes of frozen shoulder in some cases, particularly cases like rotator cuff tendon tears or cases like arthritis, which are actually not going to get better with physiotherapy or joint injection. And there's no point just waiting, because these are the patients who would need surgery. Many of these patients of painful and stiff shoulder can be completely cured by arthroscopic surgery. So it's not even an open surgery. We just make small holes to put the arthroscope or a telescope inside the joint, and looking on the camera screen, we can treat the problem which is causing the pain and stiffness, and the patient recovers much faster than he would without the surgery or with other kind of open surgeries. So frozen shoulder is not automatically cured by physiotherapy. Many of these cases actually do not get better with physiotherapy. Some of them do and some of them don't. Those who don't get better will benefit significantly from other interventions, maybe a joint injection, a simple thing, or maybe even surgery, which may be arthroscopic or very rarely an open surgery.